Hello, future healthcare heroes. If you're gearing up for your CNA exam, you've landed in just the right place.
Question 1. A resident has right-sided weakness. When assisting the resident with dressing, which arm should be put into the sleeve first? Option A, the left arm. Option B, the right arm. Option C, either arm, it doesn't matter. Option D, both arms simultaneously. The correct answer is B, the right arm. When assisting a resident with weakness on one side, you always start with the weaker or affected side first. This allows for easier manipulation and reduces strain on the weak limb. Question 2. A CNA is taking a resident's vital signs. The resident's blood pressure is 140/90 mmGh. This blood pressure reading is considered option A, normal, option B, hypotensive, option C, hypertensive, option D, bradycardic. The correct answer is C, hypertensive. A blood pressure reading of 140/90 mmGh is elevated and generally considered high blood pressure or hypertension. Normal blood pressure is typically below 120/80 mmGh. Question 3. What is the most important reason for a CNA to wear gloves when providing perineal care? Option A, to prevent the resident from getting cold. Option B, to keep the CNA's hands clean. Option C, to protect the CNA and prevent the spread of infection. Option D, to make the resident feel more comfortable. The correct answer is C, to protect the CNA and prevent the spread of infection. Gloves are a crucial component of standard precautions, designed to create a barrier between the caregiver and potential pathogens, thus preventing the transmission of microorganisms. Question 4. Before serving a meal to a resident, what is the most important thing a CNA should do? Option A, check the resident's weight. Option B, offer a bedpan or assist to the commode. Option C, turn on the television. Option D, adjust the room temperature. The correct answer is B, offer a bedpan or assist to the commode. It's important to offer toileting before meals to ensure the resident is comfortable and can enjoy their meal without interruption. Question 5. A resident has just finished eating. The CNA should document the resident's intake. What is the best way to measure fluid intake? Option A, by counting the number of sips. Option B, by estimating in ounces. Option C, by measuring in milliliters, ml. Option D, by noting the size of the cup. The correct answer is C, by measuring in milliliters, ml. Accurate fluid intake is best measured in milliliters as it is a precise unit of measurement used in healthcare. Many facilities use calibrated cups for this purpose. Question 6. A resident is on strict I&O, intake and output. The resident drink 1 8-ounce glass of water. How many ml should the CNA document? Option A, 8 ml. Option B, 160 ml. Option C, 240 ml. Option D, 480 ml. The correct answer is C, 240 ml. There are approximately 30 milliliters in 1 ounce, so 8 ounces multiplied by 30 milliliters per ounce equals 240 milliliters. Question 7. When ambulating a resident who is weak on one side, where should the CNA stand? Option A, on the resident's strong side. Option B, on the resident's weak side. Option C, slightly in front of the resident. Option D, slightly behind the resident. The correct answer is B, on the resident's weak side. Standing on the weak side allows the CNA to provide support and stability, anticipating any loss of balance on that side and preventing falls. Question 8. What is the normal range for an adult's oral temperature? Option A, 96.6 degrees Fahrenheit to 97.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit to 98.6 degrees Fahrenheit. Option C, 98.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. Option D, 99.6 degrees Fahrenheit to 100.6 degrees Fahrenheit. The correct answer is B, 97.6 degrees Fahrenheit to 98.6 degrees Fahrenheit. The average normal oral temperature for an adult is 98.6 degrees Fahrenheit, 37 degrees Celsius, with the normal range typically being considered to be between 97.6 and 99.6 degrees Fahrenheit. But option B is the most commonly accepted normal range on exams. Question 9. A resident begins to fall while the CNA is ambulating them. What is the best action for the CNA to take? Option A, try to stop the fall completely by holding them up. Option B, step away quickly to avoid injury to self. Option C, ease the resident to the floor, protecting their head. Option D, call for help immediately before doing anything. The correct answer is C, ease the resident to the floor, protecting their head. It is nearly impossible and dangerous to try and stop a fall once it has started. The safest action is to guide the resident down gently, protecting their head to minimize injury. Then call for help. Question 10. What is the primary purpose of hospice care? Option A, to cure terminal illnesses. Option B, to provide rehabilitation after surgery. Option C, to provide comfort and support to terminally ill residents and their families. Option D, to help residents regain independence. The correct answer is C, to provide comfort and support to terminally ill residents and their families. Hospice care focuses on palliative care, meaning it aims to provide comfort and improve the quality of life for individuals with a life-limiting illness rather than curing the illness. Question 11. Which of the following is an example of neglect? Option A, a CNA assisting a resident with their shower. Option B, a CNA failing to turn a bedridden resident, resulting in a pressure ulcer. Option C, a CNA reporting a change in a resident's condition to the nurse. Option D, a CNA helping a resident choose their meal from a menu. The correct answer is B, a CNA failing to turn a bedridden resident, resulting in a pressure ulcer. Neglect is the failure to provide goods and services necessary to avoid physical harm, mental anguish, or mental illness. Failing to provide essential care, like turning a bedridden resident, which can lead to harm, is a clear example of neglect. Question 12. When assisting a resident with eating who has dysphagia or difficulty swallowing, the CNA should: Option A, offer large bites of food. Option B, give thin liquids quickly. Option C, encourage talking while eating. Option D, ensure the resident is in an upright position. The correct answer is D, ensure the resident is in an upright position. For residents with dysphagia, sitting upright helps prevent aspiration, or food or liquid entering the airway, and makes swallowing easier and safer. Question 13. The most accurate way to check a resident's temperature is usually by which method? Option A, oral. Option B, axillary. Option C, rectal. Option D, tympanic. The correct answer is C, rectal. Rectal temperatures are generally considered the most accurate as they reflect the core body temperature and are less affected by external factors. Question 14. What is the normal range for an adult's pulse rate? Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is B, 60 to 100 beats per minute. The normal resting pulse rate for adults is typically between 60 and 100 beats per minute. Question 15. A resident has an indwelling urinary catheter. What is the most important thing a CNA should do regarding catheter care? Option A, clamp the catheter tubing nightly. Option B, tape the catheter tubing to the resident's thigh. Option C, keep the drainage bag below the level of the bladder. Option D, empty the drainage bag only when it is completely full. The correct answer is C, keep the drainage bag below the level of the bladder. This prevents urine from flowing back into the bladder, which can cause infection. Question 16. How often should a bedridden resident be repositioned to prevent pressure ulcers? Option A, every 4 to 6 hours. Option B, every 3 hours. Option C, every 2 hours. Option D, once a shift. The correct answer is C, every 2 hours. Regular repositioning, ideally every 2 hours, is crucial for preventing pressure ulcers by relieving pressure on bony prominences. Question 17. Which of the following is a sign of a urinary tract infection or UTI? Option A, clear pale yellow urine. Option B, increased appetite. Option C, fever and painful urination. Option D, decreased frequency of urination. The correct answer is C, fever and painful urination. Common signs of a UTI include fever, painful or burning urination, also known as dysuria, frequent urination, urgency, and sometimes cloudy or foul-smelling urine. Question 18. When providing passive range of motion or PARM exercises, the CNA should: Option A, move the joint past the point of pain. Option B, never support the joint. Option C, move the joint slowly and gently to the point of resistance. Option D, perform exercises only once a day. The correct answer is C, move the joint slowly and gently to the point of resistance. Passive range of motion exercises should be performed carefully, supporting the joint and moving it only to the point of resistance, not pain. Question 19. What is the correct term for a resident who has difficulty speaking? Option A, aphasia. Option B, dysphagia. Option C, apraxia. Option D, ataxia. The correct answer is A, aphasia. Aphasia is a language disorder that affects a person's ability to communicate, including speaking, understanding speech, reading, and writing. Question 20. A resident is experiencing pain. Which of the following is an objective sign of pain? Option A, the resident states, "I have a headache." Option B, the resident grimaces and guards the painful area. Option C, the resident requests pain medication. Option D, the resident appears anxious. The correct answer is B, the resident grimaces and guards the painful area. Objective signs are observable and measurable. Grimacing and guarding are physical reactions that can be seen by others, indicating pain. Question 21. What is the first thing a CNA should do if a resident falls? Option A, call the resident's family. Option B, help the resident up immediately. Option C, stay with the resident and call for the nurse. Option D, document the fall in the resident's chart. The correct answer is C, stay with the resident and call for the nurse. The immediate priority is the resident's safety. Stay with them, ensure they are not in immediate danger, and then alert the nurse who can assess for injuries. Question 22. Which of the following is a normal age-related change in the cardiovascular system? Option A, increased heart rate. Option B, hardening of the arteries. Option C, decreased blood pressure. Option D, stronger pulse. The correct answer is B, hardening of the arteries. As people age, arteries can become less elastic and stiffer, a condition known as arteriosclerosis, which is a normal age-related change that can affect blood pressure. Question 23. When assisting a resident with a weak right side to transfer from the bed to a wheelchair, the wheelchair should be placed, option A, on the resident's left side facing the foot of the bed. Option B, on the resident's right side facing the head of the bed.
Option C. On the resident's strong or left side, angled toward the bed. Option D. On the resident's weak or right side, angled toward the bed. The correct answer is C. On the resident's strong or left side, angled toward the bed. This allows the resident to pivot on their stronger leg, making the transfer safer and easier. Question 24. What is the best way to communicate with a resident who has hearing loss? Option A. Shout loudly. Option B. Speak in a normal tone directly facing the resident. Option C. Speak quickly to get the message across. Option D. Write everything down. The correct answer is B. Speak in a normal tone directly facing the resident. Speaking clearly at a normal volume and facing the resident allows them to read lips if they can, and to better hear your voice. Shouting can distort sound. Question 25. A resident has a new order for NPO. What does this mean? Option A. No oxygen prescribed. Option B. Nothing by mouth. Option C. Nurse's preference only. Option D. New patient orientation. The correct answer is B. Nothing by mouth. NPO is a medical abbreviation for nil per os, meaning nothing by mouth. Question 26. What is the purpose of donning personal protective equipment, or PPE, such as a gown, mask, and gloves? Option A. To make the resident feel more comfortable. Option B. To protect the CNA from splashes or sprays of body fluids. Option C. To keep the room clean. Option D. To help the CNA perform tasks faster. The correct answer is B. To protect the CNA from splashes or sprays of body fluids. PPE creates a barrier to protect healthcare workers from exposure to infectious materials and to prevent the spread of infection. Question 27. Before leaving a resident's room, what is the most important safety check a CNA should perform? Option A. Ensure the resident's bed is in the lowest position and the call light is within reach. Option B. Turn off all the lights. Option C. Close the resident's door completely. Option D. Check that the television is on the resident's favorite channel. The correct answer is A. Ensure the resident's bed is in the lowest position and the call light is within reach. This is a crucial safety measure to prevent falls and ensure the resident can easily call for assistance when needed. Question 28. What is the most common cause of choking in residents? Option A. Talking while eating. Option B. Eating too quickly. Option C. Dentures not fitting properly. Option D. Food being cut into pieces that are too large. The correct answer is D. Food being cut into pieces that are too large. Large pieces of food are more difficult to chew and swallow, increasing the risk of choking. What nutrient is essential for tissue repair and growth? Option A. Carbohydrates. Option B. Fats. Option C. Proteins. Option D. Vitamins. The correct answer is C. Proteins. Proteins are the building blocks of the body and are crucial for the repair and growth of tissues, muscles, and organs. Question 30. What is the normal range for an adult's respiratory rate? Option A. 8 to 12 breaths per minute. Option B. 12 to 20 breaths per minute. Option C. 20 to 24 breaths per minute. Option D. 24 to 30 breaths per minute. The correct answer is B. 12 to 20 breaths per minute. The normal resting respiratory rate for adults is typically between 12 and 20 breaths per minute.
Question 31. When assisting a resident with a shower, what should the CNA do first? Option A. Turn on the water to maximum heat. Option B. Gather all necessary supplies. Option C. Leave the resident alone in the shower. Option D. Ask the resident to undress themselves in the shower. Explanation. The correct answer is B. Gather all necessary supplies. It's crucial to have everything ready before starting care to ensure efficiency, resident safety, and prevent the need to leave the resident unattended. Question 32. What is the purpose of sequential compression devices, or SCDs? Option A, to warm the resident's legs. Option B, to prevent pressure ulcers. Option C, to improve circulation and prevent blood clots. Option D, to provide passive range of motion. Explanation. The correct answer is C, to improve circulation and prevent blood clots. SCDs inflate and deflate, gently compressing the legs to promote blood flow and reduce the risk of deep vein thrombosis, or DVT, also known as blood clots. Question 33. A resident with Alzheimer's disease is pacing and agitated. What is the best response by the CNA? Option A, tell the resident to sit down and be quiet. Option B, restrain the resident to prevent wandering. Option C, try to identify the cause of the agitation and offer comfort or distraction. Option D, ignore the behavior as it is common with Alzheimer's. Explanation. The correct answer is C. Try to identify the cause of the agitation and offer comfort or distraction. Agitation often has a root cause, such as pain, hunger, needing to use the restroom, or boredom. Understanding and addressing the cause or providing a calming distraction is the most appropriate and person-centered approach. Question 34. When documenting care, which of the following is most important? Option A, use medical jargon to sound professional. Option B, document immediately after completing the task. Option C, only document positive changes in condition. Option D, write in pencil so mistakes can be erased. Explanation. The correct answer is B. Document immediately after completing the task. Prompt and accurate documentation ensures that the information is current, reliable, and reflects the care provided. It prevents forgetting details. Question 35. What is the term for a sudden drop in blood pressure when a resident stands up, often causing dizziness? Option A, hypertension. Option B, hypotension. Option C, orthostatic hypotension. Option D, tachycardia. Explanation. The correct answer is C, orthostatic hypotension. This is a specific type of low blood pressure that occurs when changing positions, especially from lying or sitting to standing. Question 36. A resident reports feeling nauseous and then vomits. What is the first thing the CNA should do? Option A, clean up the vomit immediately. Option B, offer the resident a glass of water. Option C, turn the resident's head to the side if they are lying down. Option D, document the amount of vomit. Explanation. The correct answer is C. Turn the resident's head to the side if they are lying down. This prevents aspiration of vomit into the lungs, which can be very dangerous. Question 37. What is the purpose of providing back rubs to residents? Option A, to increase blood pressure. Option B, to stimulate digestion. Option C, to promote circulation and relaxation. Option D, to prevent skin breakdown on the face. Explanation. The correct answer is C, to promote circulation and relaxation. Back rubs can improve blood flow to the skin, reduce muscle tension, and provide comfort and relaxation. Question 38. Which of the following is a normal change of aging in the integumentary or skin system? Option A, increased skin elasticity. Option B, thicker skin. Option C, dry, fragile skin. Option D, faster wound healing. Explanation. The correct answer is C, dry, fragile skin. As people age, their skin tends to become thinner, drier, and less elastic, making it more fragile and prone to tears and slower healing. Question 39. When emptying a urinary drainage bag, the CNA should, Option A, allow the spigot to touch the measuring container. Option B, wear gloves. Option C, document the amount only if it's more than 500 milliliters. Option D, empty it only at the end of the shift. Explanation. The correct answer is B, wear gloves.
This is a standard precaution to protect the CNA from contact with body fluids. The spigot should not touch the container to prevent contamination. The medical term for difficulty breathing is option A, apnea, option B, tachypnea, option C, dyspnea, option D, bradypnea. Explanation: the correct answer is C, dyspnea. Dyspnea refers to the subjective sensation of difficult or labored breathing.
Question 41. A resident is refusing to eat their meal. What is the best action for the CNA to take? Option A. Force the resident to eat. Option B. Remove the tray and report to the nurse. Option C. Offer alternatives or try to find out why the resident is refusing. Option D. Tell the resident they cannot have snacks later if they don't eat now. Explanation: the correct answer is C. Offer alternatives or try to find out why the resident is refusing. There could be various reasons for refusal, such as pain, dislike of food, or not being hungry. The CNA should try to understand and offer solutions before simply removing the tray. Question 42. Which of the following is a correct principle of body mechanics when lifting? Option A. Bend at the waist. Option B. Use your back muscles. Option C. Keep the object away from your body. Option D. Keep your back straight and lift with your legs. Explanation: the correct answer is D. Keep your back straight and lift with your legs. Proper body mechanics involve using the strong leg muscles, keeping the back straight, and holding the object close to the body to prevent injury. Question 43. A resident's care plan states they need assist of 1 for transfers. This means the resident: Option A. Needs total assistance from 1 person. Option B. Can transfer independently with verbal cues. Option C. Needs 1 person to provide physical assistance. Option D. Should not be transferred by only 1 person. Explanation: the correct answer is C. Needs 1 person to provide physical assistance. Assist of 1 means 1 person needs to physically help the resident during the transfer. Question 44. What is the purpose of elastic stockings, often called TED hose? Option A. To prevent pressure ulcers on the legs. Option B. To warm the resident's feet. Option C. To promote venous return and prevent blood clots. Option D. To support weak leg muscles. Explanation: the correct answer is C. To promote venous return and prevent blood clots. TED hose apply compression to the legs, helping blood flow back to the heart and reducing the risk of blood clots. Question 45. Which of the following is considered a fire safety rule? Option A. Keep fire exits blocked for security. Option B. Store flammable materials near heat sources. Option C. Know the location of fire extinguishers and exits. Option D. Use elevators during a fire evacuation. Explanation: the correct answer is C. Know the location of fire extinguishers and exits. This is a fundamental fire safety principle along with knowing the RACE, which stands for Rescue, Alarm, Confine, Extinguish, or Evacuate, and PASS, which stands for Pull, Aim, Squeeze, Sweep procedures. Question 46. When a resident is unconscious, how should their oral care be performed? Option A. Use a toothbrush with a lot of toothpaste. Option B. Position the resident on their side with their head turned. Option C. Provide care only once a day. Option D. Give them a cup of water to rinse their mouth. Explanation: the correct answer is B. Position the resident on their side with their head turned. This helps prevent aspiration of fluids or debris into the lungs during oral care. Question 47. What is the most important thing to do before entering a resident's room? Option A. Knock and wait for permission to enter. Option B. Check the resident's care plan. Option C. Gather all supplies. Option D. Announce your name loudly. Explanation: the correct answer is A. Knock and wait for permission to enter.
This respects the resident's privacy and dignity and is a fundamental part of providing person-centered care. Question 48. What is the medical term for a bluish discoloration of the skin, lips, or nail beds due to lack of oxygen? Option A, jaundice. Option B, erythema. Option C, cyanosis. Option D, pallor. Explanation. The correct answer is C, cyanosis. Cyanosis indicates a lack of oxygen in the blood and is a serious sign that requires immediate attention. Question 49. When measuring a resident's height, the resident should be Option A, lying down in bed. Option B, standing without shoes. Option C, sitting in a wheelchair. Option D, standing with shoes on. Explanation. The correct answer is B, standing without shoes. To get an accurate height measurement, the resident should be standing straight, without shoes, and with their heels against the measuring device. Question 50. What is the most important reason for a CNA to accurately document a resident's intake and output, or I&O? Option A, to justify the cost of care. Option B, to help the doctor diagnose the resident's condition. Option C, to assist the nurse and doctor in monitoring fluid balance and kidney function. Option D, to ensure the resident is eating enough. Explanation. The correct answer is C, to assist the nurse and doctor in monitoring fluid balance and kidney function. Accurate I&O is crucial for assessing hydration, kidney function, and identifying potential fluid imbalances, which guides medical treatment.
Question 51. What is the most effective way to prevent the spread of infection? Option A, wearing a mask constantly. Option B, using hand sanitizer frequently. Option C, practicing proper hand hygiene. Option D, isolating all sick residents. The correct answer is C, practicing proper hand hygiene. Hand washing with soap and water or using alcohol-based hand sanitizer is the single most effective way to prevent the spread of microorganisms. Question 52. A resident who is incontinent of urine and stool requires frequent perineal care. What is a key principle to remember when providing this care? Option A, clean from back to front. Option B, use hot water for disinfection. Option C, clean from front to back. Option D, reuse washcloths for efficiency. The correct answer is C, clean from front to back. This is crucial to prevent the spread of bacteria from the anal area to the urethra, which can cause urinary tract infections. Question 53. The medical term for a low blood sugar level is Option A, hyperglycemia. Option B, hypoglycemia. Option C, hypertension. Option D, hypotension. The correct answer is B, hypoglycemia. Hypoglycemia refers to abnormally low blood glucose or sugar levels, which can be dangerous. Question 54. What is the purpose of assisting a resident with range of motion, or ROM, exercises? Option A, to strengthen muscles. Option B, to increase flexibility and prevent contractures. Option C, to decrease circulation. Option D, to help the resident gain weight. The correct answer is B, to increase flexibility and prevent contractures. ROM exercises help maintain joint mobility, prevent stiffness, and reduce the risk of contractures, which are permanent shortening of muscles or tendons. Question 50. A resident with a feeding tube is receiving a continuous feeding. What is an important observation for the CNA to report immediately to the nurse? Option A, the resident is watching television. Option B, the resident's skin is warm and dry. Option C, the resident is coughing or gagging. Option D, The feeding pump is making a soft humming noise. The correct answer is C. The resident is coughing or gagging. Coughing or gagging during a feeding can indicate aspiration, where formula enters the lungs, which is a medical emergency. Question 57. A resident who had a stroke has one-sided neglect. This means the resident, option A, is intentionally ignoring that side of their body. Option B, is unable to see on that side. Option C, does not recognize or respond to stimuli on the affected side of their body. Option D, has paralysis on one side. The correct answer is C, does not recognize or respond to stimuli on the affected side of their body. One-sided neglect, also called unilateral neglect, is a neurological condition where a person fails to attend to one side of space even though they have no sensory or motor deficit on that side. Question 58. What is the correct procedure for weighing a resident who is able to stand? Option A, have the resident wear heavy clothes and shoes. Option B, weigh the resident at different times of the day. Option C, have the resident void, wear minimal clothing, and weigh them at the same time each day. Option D, estimate their weight if they refuse to stand on the scale. The correct answer is C, have the resident void, wear minimal clothing, and weigh them at the same time each day. Consistency in conditions, same time, minimal clothing, and after voiding, ensures the most accurate and comparable weight measurements. Question 59. Which of the following is a sign of a fecal impaction? Option A, frequent loose stools. Option B, hard, dry stools. Option C, abdominal distension and liquid stool leaking around the impaction. Option D, increased appetite. The correct answer is C, abdominal distension and liquid stool leaking around the impaction. A fecal impaction is a mass of hardened stool that cannot be passed. Liquid stool may leak around the obstruction, and the resident may experience abdominal pain and distension. Question 60. The term ADLs refers to option A, advanced daily learning. Option B, activities of daily living. Option C, acute disease list. Option D, assisted daily long-term. The correct answer is B, activities of daily living. ADLs are routine tasks that people tend to do every day without assistance, such as eating, bathing, dressing, toileting, and ambulating.
Question 61. What is the most appropriate way to address a resident with dementia? Option A, use pet names like honey or sweetie. Option B, speak loudly and quickly. Option C, use their preferred name and speak clearly and calmly. Option D, talk to them like a child. Explanation. The correct answer is C. Use their preferred name and speak clearly and calmly. This shows respect, maintains their dignity, and helps them process information more easily. Question 62. A resident complains of numbness and tingling in their arm. This should be reported to the nurse because it could indicate Option A, a normal part of aging. Option B, poor circulation or nerve compression. Option C, the need for more exercise. Option D, a sign of hunger. Explanation. The correct answer is B, poor circulation or nerve compression. Numbness and tingling, also known as paresthesia, can be a sign of compromised blood flow or nerve damage, which requires prompt assessment by a nurse. Question 63. When ambulating a resident, the CNA should always ensure the resident is wearing Option A, slippers with no tread. Option B, loose-fitting shoes. Option C, non-skid footwear. Option D, only socks. Explanation. The correct answer is C, non-skid footwear.
Non-skid footwear is essential for preventing slips and falls during ambulation. Question 64. What is the correct way to identify a resident before providing care? Option A. Ask, "Are you Mrs. Smith?" Option B. Check the resident's identification bracelet and ask their name. Option C. Refer to the picture on the chart. Option D. Look at the name on the door. Explanation. The correct answer is B. Check the resident's identification bracelet and ask their name. This provides two identifiers and ensures you are providing care to the correct resident, preventing serious errors. Question 65. A resident has a fever. What is a common comfort measure a CNA can provide? Option A. Offer a warm blanket. Option B. Administer antipyretic medication. Option C. Provide a cool, moist cloth to the forehead and encourage fluids. Option D. Restrict fluid intake. Explanation. The correct answer is C. Provide a cool, moist cloth to the forehead and encourage fluids. These are comfort measures within the CNA's scope of practice that can help reduce discomfort associated with fever. Administering medication is for the nurse. Question 66. What is the purpose of standard precautions in healthcare? Option A. To prevent all infections from spreading. Option B. To protect only residents from infection. Option C. To treat all body fluids as potentially infectious. Option D. To be used only for residents with diagnosed infections. Explanation. The correct answer is C. To treat all body fluids as potentially infectious. Standard precautions are infection control practices that apply to the care of all patients in all healthcare settings, regardless of their diagnosis, assuming all body fluids could carry infectious agents. Question 68. A resident has a pureed diet. What is the most important consideration for this diet? Option A. It must be served cold. Option B. It should be visually appealing and appetizing. Option C. It contains only sugary foods. Option D. It is high in fiber. Explanation. The correct answer is B. It should be visually appealing and appetizing. Pureed foods, while necessary for swallowing difficulties, can often look unappetizing. Making them visually appealing is crucial to encourage intake and ensure proper nutrition. Question 69. When assisting a resident with showering, the water temperature should be checked by Option A. Asking the resident to check it. Option B. Placing your elbow in the water. Option C. Using a thermometer. Option D. Feeling the water with your wrist. Explanation. The correct answer is D. Feeling the water with your wrist. The skin on the wrist is more sensitive than the hand and can better gauge a safe and comfortable temperature for the resident, preventing burns. Question 70. The proper technique for applying anti-embolism stockings, or TED hose, is to Option A. Roll them down to the ankles after application. Option B. Apply them only when the resident is active. Option C. Apply them while the resident is in bed before getting up. Option D. Ensure they are wrinkled around the ankles for comfort. Explanation. The correct answer is C. Apply them while the resident is in bed before getting up. This is because swelling is at its lowest after a period of rest, allowing for the most effective and comfortable application of the stockings. They should be smooth and wrinkle-free to avoid pressure points.
Congratulations on completing this CNA crash course. If you ace these questions, you're well on your way to certification. If not, don't worry, review the explanations and focus on tricky areas. Next steps, watch the exam below. Link in description. Comment below with your score or questions. Subscribe for more CNA tips and clinical skill breakdowns. Remember, every great CNA started exactly where you are now. Keep pushing forward. Your patients will thank you. Until next time, stay study strong.